Good morning and welcome to the Health and Social Services for September the 9th. I'm going to call the roll. And thank you for that. Any declarations of interest in any matters dealing with Health and Social Services today? Hearing none, I'm going to move forward. And I'm going to take a little levity and as chair, I want to take this opportunity to express for last Wednesday to all the staff that were present in the meeting of our community in Whitby. I want to apologize to the staff members for the conduct that you were witness to and that you all stuck around to help to give information to the community. And I'm going to tell you, as I was in the room and in the middle of the room, I saw each and every one of your faces, and I appreciate the work that you do, and thank you for that. I'm looking for the adoption of the minutes of Health and Social Services from June 8th. Councillor Anderson, seconded. Councillor Dyes. Any questions? Hearing none. All in favor? Any opposed? Hearing none. Moving forward. Statutory meetings, we don't have any presentations. Moving to 5.1, and I welcome Becky Wall, Manager of Population Health.
Good morning, everyone. Thank you for this opportunity to present on the school health program. My name is Becky Wall. I am a program manager in the Population Health Division. This presentation aims to address some of the school-based mental health and addictions questions that were raised at the June Council and also complements the notes circulated to Council in July. Next slide, please. So the Ontario Public Health Standards, published by the Minister of Health, specify the mandatory health programs and services provided by boards of health. The Health Department is required to examine the interplay between the individual, family, school, and community and societal factors to develop programs and services to reduce the burdens associated with substance use and mental health. Next slide, please. In addition to the Ontario Public Health Standards, guidelines also provide direction to boards of health. Guidelines are program and topic-specific documents with which direction on how boards of health provide specific requirements within the standards. And you'll see on the slide that I've listed the relevant guidelines for this presentation. Next slide, please. So what is a healthy school? It's a comprehensive approach to health to improve the environments where children, staff, and parents live and learn. Both education and public health work towards the goal of healthy schools. Next slide, please. Comprehensive school health is an internationally recognized approach to supporting student outcomes. The whole school model incorporates well-being as an essential aspect of student achievement. Social and physical environment, teaching and learning, healthy school policy, partnerships and services are interrelated components that comprise the comprehensive school approach. When actions are harmonized in all four components, students are supported to realize their full potential. In the classroom, comprehensive school health facilitates improved academic achievement and can lead to fewer behavioral problems. In the broader school environment, it helps students develop the skills they need to be physically and emotionally healthy for life. Next slide, please. Foundations for a Healthy School is an approach that has been adopted by the Ministry of Education. It aligns with the comprehensive school health model, and it's evidence-based and emphasizes that for change to occur, all areas or pillars are needed to be addressed. Evidence supports that addressing health topics in these 5 components in a comprehensive approach has a greater impact to create change and therefore positively impact student health. Under curriculum, teaching, and learning, this area includes health and physical education curriculum, a variety of teaching strategies and opportunities for students to learn and practice healthy active living and professional learning. Under the school and classroom leadership, this area includes integration of healthy school policies and programs, collection and review of data or feedback to identify school goals and priorities, and to establish a plan to address these, and positive role modeling. Student engagement includes opportunities for students to be actively involved in matters related to their health and well-being, and involved in planning, implementation, and evaluation of school-wide initiatives. Under the social and physical environments, this area includes support for positive relationships, features or aspects of school premises and surroundings, and the availability of materials and equipment. And finally, homeschool community and partnerships. This area includes engaging and collaborating with parents and school community partners. This could be through a school council, a student council, working with the school board, public health working alongside with community partners, and it's really the coordination of services. Next slide, please. So all elementary and secondary schools in the region have an assigned public health nurse who supports comprehensive school health. Public health nurses assess local needs, plan and implement strategies in collaboration with the school community. Public health nurses are involved in school health action teams, youth engagement strategies, provide curriculum support. We also attend parent council meetings, safe school committees, and other school wellness committees. And in addition, we implement the vision screening for all senior kindergarten students, as well as assist with our vaccination clinics in schools. Next slide, please. So the next two slides speak to some local data from our Ontario Student Drug Use and Health Survey, also known as OSTUS. OSTUS is a population survey of Ontario students in grades 7 to 9, and it's the longest ongoing school health survey in Canada. It's self-administered, it's anonymous, and it's conducted every 2 years. We know from the data and what we're seeing and hearing in schools that the priority areas of focus are substance use and mental health. There is a new data collection cycle underway with OSTUS, and once released, the results will be used to guide our program and policies to improve health and well-being of students. Next slide, please. The data tells us that e-cigarette or vaping is a priority in schools. We saw this before the pandemic, and we're seeing this even more so now. And also, school mental health remains a high priority for students and staff. During the 2022-2023 school year, schools consulted their PHN on mental health and vaping in schools as two of our priority topics. Next slide, please. Some examples of strategies public health nurses use in schools related to substance use and mental health are listed here. It's not an exhaustive list, but it's many of our main sort of initiatives. So nurses work to address substance use, risk, and protective factors to prevent or delay the age of initiation of substances. Not an Experiment is a youth engagement program designed to deliver health teaching on vaping to grades 7 and 8 peers. Brief Contact Intervention is a training for educators to allow them to have 5 to 10-minute discussions with students throughout the day, throughout the week, throughout the year on vaping and smoking cessation. Our Durham Youth Drug Awareness Conference is an annual conference with community partners in partnership with our school board, and it's high schools to deliver comprehensive strategies in schools on mental health, substance use, and vaping. We had one already at the end of 2023, and we're planning for 2 conferences this coming school year. Talking about mental health, or also known as TAMI, is a program for youth in schools to raise awareness and increase understanding of mental health, reducing the stigma surrounding mental health. And the last one on that screen is School Mental Health Ontario. It supports schools on student mental health through evidence-informed strategies and services. And they recently launched mental health learning modules for educators to be able to be used in grades 7 and 8, and it's around the stigma surrounding mental health. The also new thing released this summer in July was a new policy and program memorandum, or PPM as they're called. It's 169, student mental health, and the requirements for school boards is that they develop a 3-year mental health and addiction strategy and a 1-year action plan. This is for implementation in January 2024, and we will be working alongside, as we have been already to date, with the school boards on this strategy as well. So more information to come on that. Next slide. I believe that's the end of my slides. Thank you. Open to questions.
Thank you very much, Becky, for your presentation. Is there any questions? Mayor Schumer. Oops. Mayor Schumer, can you do request again? Or I think we have all mics on for some reason. Mayor Schumer, I think you can speak right now because you're showing red.
Okay.
There you are, yes.
You can hear me okay?
I can hear you okay.
Okay, thank you. And through you, Madam Chair. Thank you very much for the presentation. And, you know, I read some good and bad, I guess, in it. But this is primarily dealing with elementary and high school. Is that correct?
Yes, that's correct.
Thank you. So can you give us an idea what we're doing? And I, you know, obviously it's a great program. We desperately need it. I don't want to go through the stories I've heard in Brock, but can you give us a rundown of how the similar program is working for our post-secondary students? And I ask that because, you know, we've seen it often where hopefully the elementary and the high school students are kind of kept in check with the influence of home life. Doesn't always work, but often it's there. But then they leave, they go to post-secondary. That check and balance of the home life isn't always there. If the student moves away to go to school post-secondary, as many do, things go off the rails. And I'm just wondering what we're doing to combat that problem.
Through the chair. Thank you. That's a great question. Pre-pandemic, we were involved with post-secondary educations. We did a lot of policy development there. A lot of our messaging for the general population around any of our substance uses or any of the national campaigns also got shared with the post-secondary. Because we're sort of still in that restoration phase, we haven't set any specific programming with post-secondary, although a lot of our messages through many of our programs do reach the post-secondary, but we will be looking at that further. But we did have committees. We sat on various meetings with post-secondary leads, both within UOIT or Ontario Tech, Durham College, the Trent location, Trent University location within the region. And we help them with their policies and their concerns, especially around vaping, smoking on properties, and many of the other issues. So we have been there before at the table, and it's likely that we'll be reaching back out.
Okay, I'm very happy to hear that we hopefully will be reaching back out because as I mentioned, this is where I have seen a lot of youth go off the rails with respect to substance abuse, and vaping, smoking, drinking, drugs, whatever it might be. They lose that control that might be in place with the home life, and so I would urge you very much to deal with that. I know we're now, when you get into post-secondary, you're now talking about individuals who are more or less adults, but they still need that care and concern because they're just not quite there yet, and the influence of these vices, I think, grows exponentially when they get into that. So thank you very much for dealing with that. That's all my questions.
Thank you. Councillor Anderson.
Thank you, Chair, and thank you for the presentation. It's good to see that there's a decrease in alcohol consumption, but it's troubling to see there's an increase in smoking and vaping. Have you looked into what's the root cause for that increase? Do you know what would have caused that spike there?
Through the chair, thank you. That's a great question. I think a lot of companies are, we know that they're targeting, even though they say they're not targeting youth, they're targeting youth through their flavors, through their advertisements, even though they're supposed to not be doing that. So I think the product that they're putting on the market is enticing youth to start. Despite the bylaws and the regulations surrounding the promotion and the sale of those products, I think that has a huge factor. The price point is certainly high, so we're wondering how students are being able to afford certain products like this. But again, it really does come down to how they're marketed, and we're aware of that. So we're really trying to advocate for those changes.
Okay. Just to follow up, I know this, you might not have an answer. What can we do to curb that? Is it more restrictive, prohibitive laws, or more, what do you think the answer is to curb that?
Through the chair, I think what we need to do is have tighter policies and bylaws around what's happening. I know we're working closely with our Health Protection Division on enforcing what exists and follow up with our vendors, and they've been very, very busy in laying charges to those vendors and specialty stores that are allowing students or young under 19 to come in and purchase. So we are working closely with them on that piece, and we continue to advocate at a provincial level as well.
One more question, Chair. A lot of I have seen this. There are adults that will go in and purchase it and then give it to these underage kids. Can we do anything about that to curb that too? Maybe have stricter enforcements?
I know the Health Protection Division have a program, if you're not familiar, the Test Shopper program, where they have underage students, going in and seeing if vendors will supply to younger students. It's very difficult, and we have messaging, or there is messaging across the province around, and various campaigns around those supplying to younger individuals, which is not okay. So there is some messaging around that. It's a hard one to get a handle on when you have, those of age supplying to younger individuals. But our Health Protection Division does a great job in keeping sort of the vendors at check and making sure that, and again, there's loopholes too with, how many things you can buy online. And, there's the issue of, well, you need a credit card, or you need this, or you need to prove your age of, your age. Well, how do you do that online? There's loopholes with that. So it is an uphill battle for sure, and it's one that we're very aware of and trying to address both at a regional level and a provincial level as well.
It is. Thank you.
Thank you.
Thank you, Chair.
Thank you. Mayor Foster. Are you speaking, Adrian? We don't hear you. Turn your microphone on. Do you want to sort out your technical difficulties first, and then we'll come back to you? All right, I'm going to turn to Councillor Dias.
Thank you. My question is about the mental health issue, particularly in the primary grades and the elementary panel. So we see an increase of children who have been diagnosed, ADD, ADHD, autism, and there's those that just don't fit in for whatever reason or don't feel they fit in. So I'm wondering what kind of program there is at that level to help those children adjust, because it does affect how successful they are throughout that curriculum and the standards they have to meet provincially.
Through the chair, thank you. That's a great question. I'm not sure I can give you a specific answer. What I can say is that we have school board mental health leads in each of the boards that we work with closely, and they have a team within each board that then works at the school level. To address any of those issues. And I know the new PPM 169 school mental health is looking at all of the tiers. It's looking at the basic, health promotion at a population health level to the various, all 4 levels. I can't speak specifically to the programming, but we can certainly follow up on that.
So would it be up to then, I guess, the staff at the school to request someone to come in and look at that?
So there would be coordination through the school mental health leads and their team at the board to be involved at the school level.
Great, thank you.
Okay. Mayor Carter.
Madam Chair, I hope you're having a great day so far. Just a question to Ms. Wall. I'm under the understanding that New Zealand is going through a process in regards to banning vaping because they really, in their studies, believe that it's doing unbelievable harm. Is that option available to the Canadian government, provincial government, or regional government in regards to banning this particular product?
Through the chair. I'm not sure that's an option at this point. I'm not working specifically in that area. I know our Tobacco Control Area Network, which is our Central East group of health units, are doing quite a bit of advocacy around vaping. I'm not sure if the absolute banning of it and where that sits. Certainly, I think with our monthly meetings with our Ministry of Health partners and our Ministry of Education partners, we're looking for stronger policies. We're looking, and they're quite well aware of the issues. But I'd have to take that back and see if that's, where that sits and how do we go there.
But to your understanding, is there no authority by our health department to be able to take the appropriate steps to ban this particular product? Do we have to have provincial blessing if we were to go down that avenue?
That's a great question, and I'm not sure I know the answer to that, but we can look into that.
Yeah, if you don't mind, just if you could take a gander at it and see if that option is available. It may be beneficial, it may not. But I just know that, like I say, New Zealand is looking at banning them, I think, starting in 25. They're giving a year and a half as kind of that transitional period to go out. But I think as you know, they have very strict guidelines in regards to smoking in public and also in regards to vaping. So it might be just an opportunity to ask. So thank you for your time, Madam Chair. Have a great day.
Thank you. We're going to try it again. Mayor Foster.
Alrighty, can you hear me now?
There we are.
Okay. Oh, and look, there's video up. I moved my phone.
You just froze. Try your mic again, Adrian. We lost him. Okay. Any further questions? Oh, there you are. Adrian, you want to try again? Want to hit request to speak? Okay, try now.
I got to go really fast because I'm not sure if it's well, it's the tech kicking me off. Really quickly, an observation from what I heard from Mayor Carter and Councillor Anderson. I was at an event last night at Ontario Place. I don't smoke, but I'm pretty sure through secondhand smoke, I inhaled about a pack of cigarettes. So enforcement certainly in those areas, and it made it unpleasant. Ms. Wall, this is part of the report, but I'm sure you're the one that's going to be answering it. There's a line in the report that suggests that teens, the use of prescription opioids is increasing in teens. I'm assuming that these are prescriptions that teens should not have access to. I can't imagine that the medical community is prescribing more, but can you help me with that? Because if it's a matter of them being prescribed, we've got a huge issue that needs to be dealt with.
Through the chair, yes, you're correct. That is in the report, and it indicates that an increase in youth prescription opioid use provincially, not statistically significant in Durham. So I would probably have to have my colleague Melissa Hutchinson speak on this piece. But in terms of a school perspective, it's not something that we see or see as a priority issue within our school settings. Yeah, I'd have to have her follow up on that. I can't speak to whether or not they are being prescribed. It sounds like there is some youth prescription, but again, Ostis is a self-administered survey, so this is data from that as well, from students in grades 7 to 12.
So Ms. Wall, if you wouldn't mind following up on that, I mean, the opioid crisis to a large degree, I think has come about because of because of improper prescriptions. And I mean, we all know the story on that. And if in fact there's a trend there, it may be interesting. Glad to read that it's not statistically significant, but if there's something going on, we may want to have an opinion. Thank you for that. Thank you for the presentation. Madam Chair, thank you.
Thank you very much. Any further questions? If not, thank you for your presentation, and we will be dealing with the correspondence later, but good work in terms of what we're moving forward with, and thank you.
Thank you so much.
Next, moving on to our second presentation, Rachel Hurstwood-Judd, Supervisor, Adult Protective Services, and Mark Grant, Area Manager for Family Services. Good morning.
Thanks everyone for having us here today. As mentioned, my name is Mark Grant. I'm the manager of the Adult Protective Service Program, also known as the APS or APSW program. And my colleague is Rachel Hurstwood-Judd, who's the supervisor of the APS program. And today we're going to be sharing some information about some of the innovative partnerships and housing stability that the program provides. And yeah, I'm not here to ask you for anything, just really sit back and enjoy the presentation. And I think something that the region is proud of and some of the things that we've been doing for sure.
Next slide, please. Adult Protective Services provides case management and advocacy services to adults with developmental disabilities living on their own in the community or transitioning to independence.
Rachel, can I just ask you to move the microphone closer to you so those online can hear too? Thank you.
Okay, thank you. Oh, that is better. I'll start over. So Adult Protective Services provides case management and advocacy services to adults with developmental disabilities living on their own in the community or transitioning to independence. The APSW program is funded by the Ministry of Children, Community and Social Services and the Region of Durham. One of the questions we often get asked is, what's the definition of a developmental disability? So in Ontario, we have a law that defines developmental disability called the Services and Supports to Promote the Social Inclusions of Persons with a Developmental Disabilities Act, also known as SIPDA. A person has a developmental disability for the purpose of this act if the person has the prescribed significant limitations in cognitive functioning and adaptive functioning, and those limitations originated before the person reached 18 years of age, are likely to be lifelong in nature and affect areas of major activity such as personal care, language skills, learning abilities, and the capacity to live independently as an adult or any other prescribed activity.
Okay, next slide. Actually, just to provide a bit of context for those who aren't aware, the APS program is part of the Family Services Division, which is part of the Social Services Department. So the people who are receiving service from us receive a service delivery model dependent on their unique needs. So this may involve short-term support, comprehensive support, supported independence, and transitional support.
Next slide, please. Our case management services include financial management aids, so supporting our clients to develop budgets and access to trustee services, which we'll speak about a little bit later. Medical dental coordination, supporting our clients to find medical professionals, attend those appointments, and understand the information being shared in those appointments. Housing assistance, supporting our clients to find affordable housing, supporting them through applying for rent-to-geared income and maintaining their housing. Educational goals, supporting individuals to finish their school goals, their school, or helping them apply for post-secondary education. Access to legal assistance, so supporting individuals with legal aid applications, attending appointments with their lawyers, and of course, attending court with the individual. Accompanying and access to individual and family counseling are, we'll speak a little bit later about a partnership we have with our family counselors in family services, and support and assistance for individuals accessing local and specialized community services and resources. So we really help with all areas of life. Whatever goal that the individual may have, the APSW will help the individual create a plan to achieve that goal. One of the interesting aspects of our program is we're not time limited. So as long as a person has an active goal, they can remain in our program for a period of time while they are achieving that goal. We have some files that we've been supporting for the last 30 years through different stages of life.
Okay, next slide. So case management is a huge part of the program, but also a huge part is the advocacy aspect of it. And this involves providing support for individuals who want to voice concerns to service providers, to access supports and services in their community, and develop self-advocacy skills to protect and promote their individual rights. So really what the APSWs, they do is they assist individuals in developing these self-advocacy skills, and with consent, they can actually act on behalf of individuals to ensure their rights are protected, and they can assist with scheduling case conferences with other service providers to ensure people are connected with the needed services.
Next slide, please. Our Adult Protective Services program philosophy. So to respect the rights of individuals to make choices and decisions based on their unique beliefs and abilities. Our service is voluntary. The person directs and determines the level of support required, and advocate for the development and expanded community services for people with developmental disabilities.
Yeah, and actually, before we go on to the next slide, just of interest, actually, part of that, I'm part of a delegation of developmental service providers. We've actually already met with Chair Henry, and coming out of that discussion is coming back to talk to you next month as part of a delegation with the other developmental service providers. So you'll be seeing me again next month. So next slide. Okay, so the basic qualifications for the APS program are, number one is to be 18 years of age or older, basically an adult protective services, have a diagnosed developmental disability, and 3, to be able to live independently in the community or moving towards independence. Actually, what we're finding is that they may not always be living independently due to the high housing costs, and so they might actually be living with family until affordable housing comes available to them.
Next slide. Why we're developing and strengthening our partnerships and collaborations. So Adult Protective Services is actively working on breaking down barriers to accessing services through partnerships and collaborations. We're developing and strengthening our partnerships in an effort to identify individuals who might not have been connected to services. So individuals who've been falling through the cracks. We'd like to support individuals to access case management, and we recognize that through case management, this can aid in life stabilization. The Ministry of Community and Social Services launched their transformation plan called Journey to Belonging in 2021. And some of the pillars of Journey to Belonging include making it easier to access support and making it easier to find support individuals need.
Okay, next slide. So this might look a little familiar to some of you. Unique to Durham, the Primary Care Outreach Program provides support to individuals who are homeless or unsheltered. The PCOP team is comprised of a social worker and a paramedic from the region of Durham. Now, what the PCOP team noticed is that they were meeting individuals who might qualify for the APSW program, but they lacked the assessments to confirm the developmental disability. So now, to address that need, we have a dedicated APSW for the PCOP and MHOP programs to make direct referrals to. The APSW meets with the individuals, assists with the DSO application, that's Developmental Services Ontario. They coordinate funded assessments and attend assessment meetings for support. Once eligibility is confirmed, the APSW continues case management support, connecting the individual to generic and developmental services, resources to aid them in living independently, housing, supports for supported independent living, passport funding, which is funding for individuals with developmental disabilities to become fully involved in their community.
Next slide, please. Great. Within the last 2 years, Adult Protective Services has expanded our outreach services, and part of that expansion includes Adult Protective Service workers being on site at Backdoor Mission bi-weekly, at the Ajax Hub bi-weekly, the Youth Refuge once a month, and then the North Durham Social Services Hubs as they rotate through the North communities. While at these hubs, the APSW is connecting with individuals who might not have been connected with the developmental services sector. So helping them through the DSO application, accessing a funded assessment, and assisting with determining eligibility for services and supports. Once eligibility is confirmed, the APSW is able to continue providing case management to aid in life stabilization.
Okay, next slide. One of the partnerships we really value is the development of a strong and consistent relationship with the Region of Durham Housing Services. So through this partnership, we have dedicated APSW units, portable housing benefits, and rent supplements. We've created housing best practices for supporting clients living in APSW units or allocated housing benefits. Actually, we've even heard that it's very much a mutual partnership. Yes, our clients benefit from these PHBs and allocations and so on, but we've also heard from the housing staff that it's great to have our APSWs working with the clients to help with things like completing annual renewals, supporting the complete taxes, unit check-ins and so on, dealing with landlord issues. So it's definitely a mutual relationship there. We've also recently focused on accessing Canada Ontario housing benefits for clients to aid in making more market rent more affordable.
Next slide. Some of our housing stats. From January to August this year, Adult Protective Services supported 97 vulnerable at-risk individuals with developmental disabilities to maintain their housing through homelessness prevention support. So homelessness prevention support can include communication with the landlord, apartment check-ins, coordination of services such as PSW support, homemakers programming, and extreme clean if needed. And of course, as Mark mentioned, support to complete their annual rent-to-geared income applications and completing their taxes to ensure that documentation is up to date and they can remain in their rent-to-geared income unit or remain eligible for a Canada Ontario housing benefit. Since January till August, we have supported 31 new individuals to secure Canada Ontario housing benefits, assisting to make market rent more affordable. That has been a large task for our team, and we're really proud of that. That's really aided in stabilizing individuals around their budgets and their preventing homelessness. We've added 2 additional Adult Protective Services rent supplement units and assisted 15 individuals to move, providing increased life stabilization. Huge thank you to housing.
Next slide. So this is another thing you might have seen something a little bit of, the Beaverton Supportive Housing. So APS is partnering with IEHSD and housing with the goal of having 10 beds for developmental services clients at the Beaverton Supportive Housing. Our vision is to have a dedicated APSW on site to provide case management and advocacy to ensure clients are able to transition to independence.
Next slide. Another one of our proud partnerships is our partnership with Ontario Works. So we have a dedicated adult protective service worker who is on site at our 200 John Street location monthly to assist case coordinators with connecting individuals with suspected developmental disabilities. So that APSW works with the individual to connect them with the DSO, access a funded assessment, and then supports with the application and ensuring that all documentation is completed to the DSO. If the individual comes back eligible for DSO, that individual's file can actually be transferred over to ODSP. Because they are considered to be part of a prescribed class, there is no medical adjudication needed at that point for the ODSP transfer. So that really does aid in further life stabilization with increasing their funding through ODSP. So that's one of our proud partnerships.
Okay. Next slide. Thanks. Another program that's unique to Durham, the APSW program identified that clients needed financial trustee support that they could access to provide assistance to clients who struggle with impulse control concerns with money management. And so a partnership between Business Affairs and Financial Management Department, BAFM, was developed. The BAFM staff is able to receive clients' ODSP, pay their bills and expenses, and issue weekly spending money while saving for the client's future. This trustee-client relationship is voluntary and can be short-term or long-term depending on the client needs. APSWs also access this support as a learning opportunity for clients. The APSW and the trustee work together to support clients through all transitions in life, such as moving, having children, going to school, working, and reporting income.
Next slide, please. Counseling. So assisting clients to generalize skills learned in therapy and supporting clients to build a trusting rapport with other professionals. We have a partnership with our family counseling side of the house. The APSWs and 4 family counselors are working together to provide therapy to individuals with developmental disabilities. Our team received training through Dr. Charlie Menendez, who specializes in developmental trauma and working with developmental disabilities. Through that integrated team, clients are receiving therapy. The APSW supports our clients to generalize the skills learned in session and apply those outside of session. That's really been a successful partnership where our staff are feeling supported and our clients are benefiting from therapy.
Okay, next slide. So a gap that was noticed in the community, in the developmental services community, was providing case management to people who do not qualify for the APS program, which is being able to live independently in the community. And so we actually created these what are called PASS case management events. And a PASS case management is available to individuals with a developmental disability, not just ones who would qualify for the APS program, and or their family members who live in Durham Region. And during these PASS, or prompt access to single session case management events, people are able to speak directly with a qualified, experienced, and knowledgeable case manager that can provide guidance on navigating community resources, information on funding, and help with application forms. So it's actually a service that's being provided. It's not just kind of showing up and handing out brochures. So these PASS case management events really try to fill this gap that's in the community.
Next slide. Our participation in a Durham College research project. So Durham Region, Durham College, and other community partners are collaborating to identify and remove barriers for children, youth, and families impacted by intellectual and developmental disabilities to ultimately eliminate the need to ever remove a child from their family or cultural community. We actually have a video that highlights this partnership, our research project that we're part of. And in this video, you will be introduced to Deb, who is one of our adult protective service workers and one of our clients who receive support through the APSW program. Could you please play the video?
The project with Durham College is research-based. Research brings community agencies and experiences together under one roof, and this is what the region is all about. Research helps to expand knowledge and leverage evidence-based learning to build a better model of care for our clients.
Hi, my name is Kay Corbier, and I'm a full-time faculty member at Durham College in the School of Health and Community Services. I'm working as a co-researcher with Amanda Campon on the research project Raising Resilient Families. So this project, for me, the way that it is designed is really exciting because we use a co-production model and we directly incorporate the voices of people with developmental disabilities.
We have found that just in bringing a steering committee together with service providers, the collaborations with parents who have living experience, with some other key researchers in this field, we have already begun to see some changes threaded through the community that have increased and bolstered or improved supports for families with a parent with a cognitive challenge.
I'm 29 years old. I've had a lot of challenges throughout life. I've been in group homes, foster care. My father passed away when I was 15. I started living by myself at 16. I do have like depression and stuff like that. Everything that goes on is like impacts me up to this day, being in the system, being abused and everything, and I try to keep it away from my kids. I have a girl named Soraya. She's 6 years old, and I do have a boy named Elijah. He's 4 years old. I've always tried to do my best I can for my kids. I deal with that. Vicky, she helps me out with that. She helps me cope with understanding the kids, how to deal with the kids, how to basically not yell at the kids, even if I'm overwhelmed.
So this is a 3-year collaboration with Durham College and the Region of Durham. Starfish Parent Support Program has been dedicated to providing support to parents with cognitive challenges to raise happy, healthy children for a number of years, as well as reducing implications of social issues such as stereotypes, impacts of institutionalization and trauma, and violations of human rights. We have proven over the years that parents with disabilities can parent very successfully.
Bibi is a young mom. She has 2 beautiful children. She's a newer Canadian and is trying to get her citizenship. She's also navigating all of the child services systems. She needs that support in order to just learn all of the skills necessary to raise her children the best that she can. They're very rambunctious but healthy, fun-loving children. They receive services such as housing support with their portable housing benefit, services from children's services, and family services.
Well, of course, we work really closely with the adult community support service workers because they provide supports to the parent. As time goes on, we work with families to develop healthy routines and habits, understand child development, sometimes manage some behavior.
I help my clients navigate systems. I advocate for them in helping them get all of their needs met on a very holistic basis. The impacts are huge because we get to see people, realize their potential, realize all of the services that are available to them to meet that potential, and to ultimately live happy, satisfied lives.
We've been able for the last several years to provide a placement opportunity for students in either the social service worker program or the developmental services worker program.
My kids, they sometimes make me insane. But you know what? That's what kids do. And we have to cope with it because you know what? When they get older, we're gonna miss them. They're gonna leave us. We're gonna miss them for sure. When we actually realize that, oh my gosh, we should have done much better for our kids, it would be too late.
Bibi's very intense in everything that she does. So she loves intensely, she gets stressed intensely. She would give you the shirt off her back. Bibi, she's really quite remarkable.
Thank you. Mark and I just wanted to mention our program actually changed our name back to Adult Protective Services. And when this video was created, we were called Adult Community Support Services. So thank you for taking the time to watch that video and meet Bibi and her support team. So thank you.
Yeah, we appreciate the time today to come and speak to you. So thank you for your interest in our programming and partnerships.
And thank you very much for the presentation this morning. I really enjoyed hearing this as well too. And I know that over the years of working with some community members and parents who are concerned about their adult children, this is great to see that we do have this in place. Do we have any questions? I am not seeing any, so thank you very much.
Okay. All right, thank you.
Online, we have for a delegation, we have James Malash for the CEO for Community Care Durham, and Melissa Rudden as well too, the lead Community Capital Development for Community Care. James, if you would like to go ahead and do your presentation.
James, you'll have to hit your request to speak button so that we can activate your microphone.
Hello, can you hear me?
Yes, we can hear you.
Okay, great. Thanks for that. Good afternoon, everyone. As I was introduced, I'm James Mwash. I'm the CEO of Community Care Durham, and it's a pleasure for me to have a few minutes of your time today. I wanted just to share with you a few things that we're working on here at Community Care Durham in hopes that we can have some further conversations. If we can move to the next slide, please. So what we're hoping to do today is to share with you our vision of aging well throughout Durham Region and our commitment to Durham Region through the creation of our Community Health and Wellness Center. We also wish to initiate conversations and partnerships focused on the future of health and wellness in Durham Region. Next slide. Many of you know us, and we really do appreciate the support of so many of you in your municipalities. But just to recap, our mission is to support people through strengthening community. And our vision is that where communities are and people are enabled to maximize their independence and thrive wherever they call home. Next slide.
James, could you speak up just a little bit too so we could all hear you?
Oh, sure. Thank you for the tip.
Yeah, that's perfect.
Okay. Just an overview of who we are and who we serve. We have 340 staff, almost 1,000 volunteers supporting nearly 10,000 clients across every part of Durham Region. Our clients aged from 16 to 106 through a wide variety of programs that we provide them through living at home, transportation services, mental health supports, and hospital avoidance. We do a lot of data collection here, and we really believe in the value of money that we provide to the taxpayer, to our community. And you can see the cost of supporting a person at home is a fraction of what it is to support them in an institution. Next slide. This is just an overview of the reach of the people we serve across Durham Region. Next slide. We believe at Community Care Durham, as the largest nonprofit service agency in Durham, that we have, a tradition of respect, of value, and of trust. It's been earned through volunteers and our hard staff for over the past 47 years. We are an anchor to the many thousands of people who rely on our service. And we want to take this opportunity to step up and to partner and innovate and invest in this community that we serve today and tomorrow. Next slide. So what is a community health and wellness center? Essentially what we're trying to create is a home away from home for residents of Durham Region to access health and wellness services delivered by integrated care teams. Our goal is to create an initial concept of the center here in Whitby, with the plan to expand to other municipalities throughout Durham in order to create long-lasting social impact. Next slide. We believe these centers will address some critical issues facing this region in particular. The population of older adults will double in the next 25 years, and almost entirely those individuals wish to live at home. The number of Durham seniors living alone is estimated to be at 20,000 individuals now. And social isolation and loneliness can lead to higher rates of dementia and mental and physical health challenges. And we all know the burnout that care partners are experiencing looking after their loved ones. We want to tell you, and you know this, that healthcare is more than hospitals and long-term care. And we need a comprehensive plan to help people live at home well where they want to live. Next slide. We hope to transform this building at Sunray and Whitby that we just purchased over a year and a half ago through our own funds into a vibrant health center for this region. And there's a couple of slides, next slide, that just give you some of the visions of what we're trying to create, and which, as I said, is a home away from home. Next slide. This home will have a day program serviced by showers and laundry for participants, a community kitchen for respite for care partners, mental health support groups, foot care clinics and a nursing station, a hair salon to help people look good, to feel good, to be good, and an expanded food services delivery program here in the green. Next slide. Again, some of the artistic renditions that we've done through our due diligence to demonstrate whether or not we can actually deliver on this vision here at this building. Next slide. The benefits for this project are vast. We can enhance our programs and services through to the residents within the region. We can create social interactions for people to connect with others in the community. We can create supports and respite for care partners. We can enhance volunteer opportunities for residents to become more engaged in their community. We can retrofit, and we will retrofit, to create a positive impact on fuel consumption and greenhouse gas emissions. And we can create partnerships with local businesses and community organizations. Next slide. We have plans to measure our success through client and care partner satisfaction, improving client independence at home, reduction of care partner stress and burnout, avoiding institutions or delaying them, preventing falls, and of course, very important in the not-for-profit sector is increasing the engagement of work for our employees and our volunteers. Next slide. We measure ourselves against our values and our mission, and I can tell you as an organization, we work very hard to achieve these goals and these numbers, where 91% of our clients tell us that we're helping them maintain their community independence, and 92% say that we're helping them meet their goals. Overall, our satisfaction numbers for clients and care partners are 92 and 97%, and these have been consistent for the last 4 years that we've been doing this data survey. Next slide. So our campaign that we are not launching today, but we've been meeting with many of you to talk about is this No Place Like Home. And our goal is to raise $3 million to do the retrofit here at 20 Sunray. Next slide. Why $3 million? We believe in this proof of concept so much that, as we said, we even bought this building here in Whitby. And our intention is that if we can prove it to you and to the taxpayers and to the clients that rely on our services, that we can expand this to other municipalities. We are not asking for operating costs. We have the funds to do this. We're looking for costs related to the renovations and the furniture and equipment required to transform this location. Next slide. So what we're hoping that you as a committee and you as members of this region to help us with our future by endorsing this concept, by helping us advocate for capital funding, and help us remove the barriers that limit clients' ability to access our services. And what I would like to leave today is also an encouragement to all of us to foster broader collaborations and conversations in Durham region across non-for-profit, for-profit, non-government organizations, government organizations, around sustainable growth for an aging community, increasing mental health challenges, homelessness, immigration, and other important health and social issues. And Community Care Durham is eager to be a part of that conversation. Next slide. So thank you, and that's, I hope I didn't take up too much of your time, but that is my contact information, and I do, again, appreciate all of you and the time you've taken to hear from me and Melissa over the last couple of weeks. Thank you, Mayor Roy.
Thank you very much, James. And is there any questions? I am going to highlight, I've had opportunity to not only tour the center, and thank you, James, for that, but also we have met and had conversation just about their project and the moving forward. There is a motion that we have prepared, if we can put it up. And I think it's just a referral to I don't know if there is any questions from members on the presentation. Okay. Mayor Schumer?
Thank you, Madam Chair. Just a quick question. The presentation itself, will that be made available? It wasn't available in the copy of the agenda I had.
We will forward it. It was received a little later yesterday, and it will be forwarded to all members of council and to committee.
Okay. Thank you very much.
You're welcome. Do we want to, can we have the motion forwarded to the chair?
So we just have that the Health and Social Services Committee recommends that the following requests from Community Care Durham be referred to finance staff for appropriate action and response. A, that Community Care Durham's concept of community health and wellness centers be endorsed, that the Region of Durham advocate for capital funding, that the Region of Durham help to remove the barriers that limit clients' ability to access our services through providing financial support, and that broader conversations and collaborations in Durham Region be fostered to address sustainable growth of an aging community, increasing mental health challenges, homelessness, immigration, and other important health and social issues.
I'm happy to move that.
Thank you. Is there a seconder? Councillor Anderson. I will comment that we do have Commissioner Taylor online too, if there's any questions, but basically this is a referral to finance. Any questions? All in favor? Any opposed? Hearing none, seeing none. Mr. Meloche, this will be referred over to our finance department, and Commissioner Taylor, I'm sure, will be in contact with you.
Thank you very much.
Thank you. We'll move forward to our correspondence. We did have a presentation on this. Can I have a mover? It's the Public Health Services to Support Schoolhouse. Motion to receive, Councillor Anderson, second by Chair Henry. All in favor? And that is moved. And next we're going to the report 7.2. This is the Durham Nuclear Health Committee membership. And I need a mover. Chair Henry, seconded. Councillor Dyes. Any questions about the appointees? All in favor? Any opposed? Thank you. No advisory committee, no social services, no advisory committee resolutions. And our next meeting is October 5th. And I need a motion to adjourn. Councillor Anderson? Chair Henry? Thank you very much. Have a great day. Oh, Mayor Carter. I just saw you popped up.
Yeah, under other business, if you don't mind,
No,
Madam
please.
Chair.
Go ahead, sorry.
I just want to take this opportunity to thank our regional chair. He has submitted a letter on September 1st, 2023 to the Right Honorable Justin Trudeau, the Honorable Pierre Poilievre, and to Jagmeet Singh to declare homelessness as a national emergency. Madam Chair, not only the package, but the language that was utilized in this correspondence by the regional chair not only was appropriate, but I think it was also a call to our federal government that they need to sit down and they need to understand that this is a national health crisis. I want to take the opportunity to be able to thank the regional chair for penning this letter, to be able to submit it. And what I would ask is that I would like to find out if we have any intention in regards to reaching out to the three leaders to be able to find out, A, have they received it, and B is, when are they scheduling this meeting? And I think that we've got to stay on top of this and not allow this to go into a file where, where it'll just collect dust. I think the regional chair is quite serious about it. I know all 8 mayors are quite serious in regards to it. And we have to have the federal government fully engaged. And I think the regional chair has done his part. But I'd like to know, how are we going to follow up on this, and how can we make sure there's a regular reporting in regards to waiting for a correspondence from either of the party leaders. So question to you, Madam Chair, and I don't know if we might be able to get some answers today.
Yes, Mayor Carter, and Chair Henry is willing to speak to this. Can you press your button?
Thank you, Mayor Carter. So the letter was sent electronically and by registered mail, not only to their riding offices, but to their offices in Ottawa. So that I'm sure that it has been received. And we'll give it just a few more days, and then I will respond again in writing the same way, saying that you've received our letter, and what will the actions be coming from your location. So we'll continue to manage it, not only electronically, but all correspondence with the 3 leaders is also being sent by registered mail.
I appreciate that, Mr. Chairman, and I'm wondering, Mr. Chairman, would it also be advisable to use the same language in regards to our provincial partners to make sure that they also are fully aware that not only are we asking the federal government, but we're also asking the provincial government also? Would that be appropriate, or do you believe that that would be advisable as our regional chair?
Mayor Carter, I'd be happy to write that letter, the same letter, and direct it to the Premier and to the appropriate staff in Ottawa and to the leaders, and do the same process, email and registered mail, and then with a follow-up.
Again, Mr. Chairman, I can't thank you enough for penning the letter. I think it was well said and well done. I also believe that with your persistence, and I know from previous persistence that you've demonstrated, such as the 407, I know that you'll be successful in getting this meeting with the 3 of them. But I speak on behalf of our city, that whatever assistance I can bring to this conversation, please let me know. And I would imagine all 8 mayors will do everything they possibly can also to make sure that we get a proper response. So just know that, Mr. Chair.
And just through you, Chair, to Mayor Carter and to Mayor Foster, with the by-election in Durham riding, I would suggest that you each pen letters to the 3 leaders as they come to canvass neighborhoods with their candidates, asking them for meetings with yourself to express your concerns, and that you take advantage of the by-election to make sure that each of the candidates understand the issues that are important in Durham riding.
I appreciate that, Mr. Chair. Would it be appropriate? Could we give them a copy of your letter? Would you feel comfortable with that?
You can share that with the population of Canada. I would be happy that this is an issue that needs to be some attention, and quite frankly, for those of us in this room and the mayors of the 8 municipalities in Durham and practically every community in this country, this is an issue that is on our laps with absolutely no leadership from the federal government on the issues. And it's disappointing, and it's time to have that kitchen table discussion about today, tomorrow, 10 years from today, and where this country is going.
Thank you, Mr. Chairman, and through you, Madam Chair. I'm hoping that our corporate communications can make sure that the media outlets are also in receipt of this letter. I think it may give some wind to the sail, and we may have some interest by local media outlets to be able to actually be able to report on it and also publish this letter. So again, Mr. Chairman, thank you for penning this letter, and I look forward to the follow-up. And please utilize any of us in a way that might be able to further this cause. Thank you, sir. Thank you, Madam Chair.
Thank you.
Thank you, Mayor Carter, and thank you, Chair Henry. We have any further other business? Not seeing none, hearing none. We do have a motion already to adjourn, and have a great day.